Good morning, everybody. Today we are going to talk about a very, very important topic, especially to the young people, And if you listen to this talk, and by the end of the talk, if you really practice few things out of this, it's really going to change somebody's life. I hope everybody of you have got this wristband, and we are going to use this at the end of the talk. And do you know, I want to ask you one very simple question. Do you know what is the most common cause of death in the world? Can anybody point it out? Heart attack, Anything else? Please just say whatever it is wrong, no problem. Diabetes, So we know, we are there. So, okay, so let's start this talk. Can I have my presentation on, please? Yeah. Okay, so if you look this chart, the number one cause of death is a cardiovascular disease. What that means, all the blood vessels which are running into our body, so they block or they rupture. So the diseases of the cardiovascular, all the vascular system, if they block, we die. And the second most common cause is a cancer, a malignancy. But that is nearly 50% less. So, but cardiovascular death is something which we can prevent. We can do a lot of things by which we don't have to die. Okay? This is not working, please. Just see. Okay. If we look into the death rate into the whole world, what did the developed world they do? They started working on this 50 years back, and they are in pink now. What that means is they started working on the cardiovascular death. And here, all the underdeveloped world, India, China, Russia, most of the population, more than 2/3 of the population where it lives, we are still behind. So we are nearly 30 to 40 years behind them. So we need to work now so that we can make a change in the next 30 to 40 years. It's not going to happen overnight, like you are going to change, because everything has to be changed. Let's look at this small video. I'm just put it for you here. It's of course a morphed video. You can see. It's not original, okay? So don't get any ideas about this. And it's a leopard, chasing a deer, and the man comes and just take the deers off. And of course, if we look into the leopard is a disease, a vascular disease. So we need to run faster than the disease. Because if we think that we are going to run slower and we are going to treat it once the disease happens, we have already actually lost the war. So we have the blood vessels here. And concentrate on the red ones. What we call arteries in medical terms. No medical jargons, just a little bit. So where the fresh blood flows from the heart to the whole body. So our whole body works on the red ones. Of course, the blood has to come back through the blue ones into our heart. But the red ones are the most important. If we are able to stop them blocking, and if they don't block, we have actually won the war. Do you know this sign? Okay? McDonald's sign. Okay? Your ECG is very good before that, and if you keep on going to the McDonald's, your ECG becomes disturbed. So it's a very important sign, people who eat a lot of McDonald's, Pizza Huts, and everything. So this is a photograph I clicked in Chandigarh. It's just a beggar. He could even purchase a burger. So the burger is so cheap. It's 18 rupees. You can't afford a meal, and burger fills your tummy up, and it's much more tastier than your normal Indian food. Why will he not eat that? And that's what is the problem. Most of, we did a study 4 years back in Chandigarh in a lot of government and private schools, and you will be surprised to know that 40% of the kids were obese. And they were both in the government and the private hospitals. It's not that only the private hospital kids were obese. So that's a very worrying sign. People don't want to play. People want to play on the phone. My kid was obese. Okay? Forget everything. Now he is very thin and smart, but he was. Okay? So we worked on him. So the lipids, the fats, they are not very good for us. And smoking. I belong to state Punjab, and fortunately, the Sikh religion don't smoke, and that's very fortunate for us. And I give a lot of lectures in Sikh groups and all, and I tell them that you must percolate this to all other religions and the societies, because smoking is one thing in any form blocks our blood vessels. So smoking in any form is very bad. And similarly, stress and their blood pressure, hypertension, it also blocks our blood vessels. And then comes the biggest culprit, which you also mentioned, is the diabetes. So diabetes is a high blood sugar in our blood. And that happens either because you're very obese or you're not producing enough insulin because of the deficiency in the pancreas. So once you have high blood sugar, then you can have a lot of problems. Now this chart is very important. Look into this. If we look into India, we have got approximately 80 million diabetics in our country, okay, in a population of 1.3 billion. And if you look into 25 years, we will have an increase of 86% diabetics in our country. So nearly, you see, we will be double. And once you have so many diabetics, look into the amount of socio-economic burden on the whole country. Our hospitals are already full. If you look into the government hospitals and the private setups, they are so busy. And if we have such a huge things coming up in the next 25 years, will be bad. But look into the developed world, what they have done. So there will be an increase in the diabetics there, but the percentage is very low. So they have actually working on this from last 50 years and dropped down the increase of the burden to 30 to 40% only. So there will be an increase. But look into the countries like Africa, who are much behind us. The increase is more than 100%. So that's why all of us, it's a duty of all of us, doctors or the health, ministers, the health cannot do it, because it's a role of everybody is required. Government can only make the policies, but you need to stop eating. So that's a problem. So if you look into the prevalence of diabetes in our country, rich people are more diabetic. And of course, it's very obvious. You eat much more than the poor people. And if you look into the top 10 countries in the world, India at present is got the highest number of diabetics in the world now. And of course, our population is also very high. But the worst thing is, look into the red lines here. We are not spending anything on the diabetic related complications by the government of India. So the amount of money what we spend as compared to the rest of the world is minuscule, totally, absolutely hardly anything. And that's why we don't hear on the front page of the newspapers, we don't see a diabetic prevention program articles. A lot of preventive things has to be done. We can't treat. There are not enough doctors in the country to treat these patients. We need to prevent. So this is an IDF. Its logo is that access to diabetic care. So that was 2022. If not now, then when? Because this is the biggest killer in the world. So just some data figures, you should know what's happening in the world. Every 10 seconds, one person dies of diabetes in the world. Every 10 seconds, 2 people will develop diabetes. Each year, 7 million people develop diabetes in the world. And if you look into the global cause of disability, 6th number is the diabetes. But if you look into all the other diseases, they are actually the cause from the diabetes. Kidney disease, heart disease, foot amputations, vascular disease, they all goes from diabetes. So if you look into this, if we are able to get control of the diabetes, we can actually work a lot on problems, medical health issues which we have. If you look into the prevalence in the India, so last 10 years, the prevalence has gone from 7.1% to 8.9%, 9%. So means 1 in 10 here will be diabetic. Okay, so that's a huge number. And if you look into the certain states in the country, the state where I belong to is Chandigarh, UT, the percentage is highest in the country is 14.5%. Maybe because we eat more and party more, and maybe because of the genes, genetics, okay. But Tripura is also very high, it's 15.5%. So imagine out of 100 people, 15 people are diabetic. Okay, so that's a huge number. Diabetes says, a lot of people say, it causes only heart disease. So that's very wrong. It of course causes heart disease, but it also affects the blood vessels all across our body. That's one of the major causes for stroke, for blindness in the eyes, for kidney failure, kidney transplants, what we require, and also for the foot ulcerations. So you have to imagine 20% of all diabetics will have a foot ulcer in their lifetime. So I'm talking about 80 million diabetics here now in our country. So imagine 20% having a foot problems, and not more than 1,000 people are trained in the whole country to treat them. So imagine what will happen, an amputation. So that's why we do get, I feel it's very underrated, but that's the data from the government sides. 100,000 amputations a year happens because of diabetics in our country. And personally, I feel it will be much, much more than this, because what we see in the clinical setup is much more, and it's not reported to the government. So there is no data collection. But this can all be prevented. Okay, so now we go to the next talks, which is very important, second part of the talk, that we can prevent this. So I'll show you some very disturbing figures. So you can close your eyes if you don't want to see. But imagine we see them every day, and the smell is so much that if one patient comes here, you all will go out of the hall. So it affects in such a bad ways. So neuropathy, diabetics affects in the legs, your nerves. Nerves is why we move our hands, we feel. So it affects. So you get different sensations like a burning, a cold sensations in the foot, and these type of pictures foot patient comes with. The most affluent people in the country, they gets affected with this, because diabetes affects most affluent people. Okay, so they get the diabetic foot, deformed toes, ulcers on the foot. And people come to us because of the neuropathy, because they cannot feel it. So people come to us because the rat has eaten their toes in the night, okay? Because they can't feel it. So they can't feel anything at all. The ants have eaten their toes. So it's very bad. They walk in the temples barefoot, and then they get blisters because they can't feel the heatness of the marble. So it's important. Diabetes also affects our blood vessels in the legs. And once it affects the leg blood vessels, so you get difficulty in walking. And if you are not getting them treated, you get gangrene. Gangrene is like you get a dead tissue. Now this is a patient, 14 years back came to us. He had a small blister. If he would have been educated, if he would have been operated on the first day, got the proper treatment, his whole foot could have been saved. But he was like, oh, this is only a snake bite in the foot. My doctor has told us. I said, this is not a snake bite, it's a diabetic bite. He said, no. He has given me an anti-snake venom, and I will be absolutely fine. And with a lot of neem on the foot, with a lot of coins. So what will happen in the 2 weeks is half of the foot is gone, of course. And we could save half of the foot, but it's late. So this is another patient who has got a blockage with a very bad foot, you can see. But once you improve the blood supply to the foot, you can save all these feet. The patient has to come early. The patient comes in such a bad state where they have been told to have an amputation done. Amputation is cutting your limb off. And it's a very deadly complication on the patient, on the family, and on the society, and on the country as a whole. It's a huge economic burden. Okay? And because we don't have a huge processes work going on in the country at present. So once we improve the blood supply, so you can save this feet, and patient can walk. Patient, even if the half of the foot, at least patient can walk on their own foot. So this we see it every day, you can imagine. So we see around 7 to 8 new patients with such bad diabetic foots in our clinics. So the aim is to prevent. Aim is not to treat, because we cannot treat so many patients. It's impossible. So the urgent requirement is to treat the public, physicians, and absolutely make a guideline. So we are in work with the government of India to develop a guidelines for the whole country, doctors, so that not only for the doctors, for also the public. So people can hear the guidelines, follow them. So I'm going to go through that. So the most important thing is how you can reduce the risks. Is if you have diabetes, please you need to be on the treatment. It's not like मेरे को पता लग जाता है मेरा शुगर कब तेज होता है, तब मैं गोली ले लेती हूँ. अरे भाई, people come like this. How to teach? So this is a very common problem. I know in the morning when I will have a high blood pressure, then I will take a medicine. So these things don't work like that. So if you are a diabetic or a blood hypertension, you need to be on a regular treatment. You should not smoke, definitely not, in any form, okay? Must treat all these diseases once they are in the early stage, because then you can delay the complications. And next 2 points are very important. We try to do an exercise every day. Try to walk for 20 minutes, 30 minutes, okay? You don't have to go to the gym to develop a body or develop a marathon. You can do it. But at least for the routine people, try to park your car a little bit away. Try not to take the lift. Just walk as much as you can while you're working in any form, in any job. You know, a lot of people tell us, I'm on a computer sitting job. I cannot walk. Please, sorry, you must be sitting somewhere. To try to walk as much as possible, because that's what, you know, is going to make you a little bit fit. And eat healthy diet. I'm going to put in some slides for diet, what you should eat, you know, and you know, just to be on the important aspects. So feet are very important, we must save. I'm going to give you 4 slides, some tips for all the diabetics, and this you should learn. Everybody in the country should learn about them, because there will be some diabetic in their home. If you are not diabetic, there will be mother or father or uncle or aunt. So you must tell them and teach them. One is, in diabetes, your feet becomes dry, to try to moisturize them. Second is, they must look at their feet in the evening every day, because you may not be able to feel it. The patient may not be able to feel, and they may have a stone or some nail in the foot because the shoe has got something or the other. Or don't walk barefoot, because you must inspect your bottom of the foot, so which is very important every day. If you develop a con, please don't treat it yourself, because what you require is a modified footwear, and also require some treatment in the hospital and in a sterile way. So please don't try to use a con caps or try to use a blades to remove the cons, because once you have an infection, you can actually die within 24 hours. So please, it's serious. So don't try to play at home. And how do I clean my feet? You must take any soap and water, wash it up, dry it between the toes, definitely, because if you leave the moisture in between the toes, you can get a fungal infection. And in diabetics, never soak your feet in water, okay? Sometimes people or the doctors also prescribe the patients when they have neuropathy that take some hot water or lukewarm water and put your feet in them for a few minutes. Don't do that, because your feet become soggy and they develop cracks and infection can go in. Always apply some moisturizing lotion, anything you can apply, because you need to make them not dry, because once you have dry, it can develop cracks, it develops infection. Nail cutting is one of the most important things. Always try to cut the nails straight, because normally, you know, we try to make the nails like curved in, you know, in the normal people, because we like that shape. But in the diabetics, try not to injure that thing at the edge, because you will not be able to feel it. It's a neuropathy. Diabetics also get retinopathy, so they don't see it well. And if you cut that small wound on that toe, can lead you to an amputation. Very common. So please, very careful about that. And when you buy the new shoes, try to buy them in the afternoon, because in the morning your shoes will be smaller, your foot will be smaller. And diabetic neuropathy, you get swelling. And in the evening, your foot will be much more swollen. So in the afternoon is the best time to buy, if you want to buy new shoes, because otherwise they will be too loose or too tight. Now this is a very important slide for everybody, including me. Okay? We must eat fruits and vegetables. Everybody knows this, but we should try. What fruits and vegetables? The darker they are, the better they are. Okay? So means tori yote light colored. Okay. We also don't like it, okay? But Karela, very green color, better. So means more the greener, more is better. Similarly with the fruits. The more the darker the fruits are, the more the better. So it's because of the colors, it's not because of artificial colors, it's because they get more nutrition. Okay. Second is, we should always try to do is whole grain. Always. Okay. Try to include that slowly and slowly. You cannot just change it in one day. But try. Okay. Try to eat a healthy source of proteins and meat and fat. Fat is important. You have to understand, if we are going to use 100 calories, so we require around 30% of that to be coming from the fat. Everything, all the cells in our body works on the fat. So fat is good, but you need to know what sort of fat. We are going to come up to that. Second is, we should try to eat as much possible, not try to eat as much stored food. Okay, so canned food, chips, Coke, pizzas, burgers, okay? All those things you should try to avoid. Anything. So you have to understand, anything which is shelved is not good. We are so lucky to be in India actually. People who live abroad, they understand, because I was abroad for 6 years, so we know. So a lot of people, they eat shelf food there, okay? In India, we got such a nice, way of living. We get fresh markets, fresh vegetables coming into the market. So try not to have a stored food at home, absolutely, okay? Now, coming to the fat part, which is important. There are basically 3 types of fat we need to understand: saturated, unsaturated, and a monosaturated. Now, saturated fat is in sausages, which we can, eat every day. Butter, poultry, in all these things. Basically, the light has gone. Sorry, the slides. So all this poultry which is there, we should try to avoid it. Okay, because saturated fats will raise your cholesterols and LDLs. Okay, so basically it blocks the arteries. That's in simple terms. And we all know blockage of the arteries is not good. If we eat any vegetable oils, soybean, safflower, whatever ad you want to see, they're all good. Okay, so you can eat that. But if you can add a bit of olive oils, peanut oils, avocados, they are much better also. But it's not that you should only eat this, okay? Because they also have a small issues with them. Now, good rule of thumb is very important. Any fat which is liquid at room temperature is good for you. Any fat which is solid at room temperature is not good. So ghee is solid, not the best form, okay, of fat. You can have it little bit off and on, but that's not the best form of fat. You should not be having all your cooking in ghee all the time, because that will raise your cholesterol levels if you're not doing exercise enough. Butter, margarine, they're all solid. So any fat which is liquid at room temperature is good, because we add an hydrogen atom to it, chemistry lessons, and we make them solid, okay? So we need liquid fat. So at home you should try to have all liquid fat. Second is, always try to change the liquid fats. Like have a sunflower oil once for 2 weeks. Never buy like 5 liters or 10 liter cans, okay? Always try to buy smaller ones, because all they have is an omega fatty acids, and some have 3, some have 6, some has 9. So you can keep on changing these vegetable oils so that you get a mixture of all the omega acids. So 2 weeks you can do cooking in safflower, 2 weeks you can cook in corn flour. So you can change the type of oil what you use in your house for cooking. This is the most important slide, alcohol. How much alcohol is very important. Okay, people, when I give a corporate lectures, smoking and alcohol is the most important topic to be discussed. I cannot go in detail here, but so these are the basic guidelines, okay? You should not drink alcohol, okay? Please, there are no studies to show there is a benefit, even of wine. So there are some studies which has been done in an isolated versus where it's been shown that if you take a glass of wine every day, that's good for your health. So people have just picked up that studies and quoted to their benefits, okay? So alcohol is, any form is not good. Okay, so this very simple thing. But if you have to take alcohol, so you should take, this is the lower risk drinking guidelines. So what that means is you should not have more than this per week. So what that means is 14 units of alcohol a week. And in layman terms means 6 glasses of beer per week, 6 glasses of wine per week, and 14 30 ml shots you can take of whiskey. Small pegs, okay? So you should not take try not to take more alcohol than this, because our body cannot metabolize more than this. So that's the upper limit one should try to keep. Coming to the last slides. So we have been working on this project, and what we call an amputation-free India, because somebody has to work on this, and His Excellency Governor of Uttarakhand has been actually very proactive, and he's not here, but he has been very proactive in supporting this cause of an amputation-free India. And so this is a few of my friends who have been working on this. So we got a lot of corporates and Rotary clubs and Lion clubs associated with this project, more than 20 now we have. So we have done a lot of events in the last few years associated, and lectures on health and how you can prevent diabetes, and senior citizens. We give lectures in the schools, because all this training, all the food habits and everything, it starts with the schools, because we need to modify our taste buds, how we are going to eat every day, and what sort of meals we should eat every day. So that's the most important, because unless we are going to take off the obesity in the schools, we are not winning the war. Because you have to understand, all the kids who are obese, the chances becomes 5 times to have a diabetes at the age of 30 years in those kids. So that's why we need to work on that school level also. We also participate in marathons. So this is a lot of people who are amputees who are doing the half marathon and full marathon. So you can see, even if you lose a leg, it's not disabling, but we should try that these patients should not lose the leg. That's the most important thing. So I need a support from all of you. So this is an Instagram. It's a social cause, and basically we put in all the teaching softwares, any help anybody require in prevention, and the lectures are there on the Instagram. You can copy them up and give a small talks in your own cities, in the schools, because that's how it's going to go, because we cannot go everywhere. And so you need to take up, some of you have to take up this program and start teaching people locally, so that we can have a healthy vascular life. So please, you got the bands here with you. If you can just raise your hand and pledge to make an amputation-free India, that will be really a great cause and help to us. Thank you.